past, working as a stroke nurse specialist, quite often when the healthcare professionals had completed their episodes of care, the patient was to some degree left isolated. The Chest, Heart and Stroke programme offers patients longer term care to meet their needs, which are very applicable, and help them pick the pieces up again so that they can return to the lives that they were living before they had the stroke, and help them to cope with the residual deficits better.
There have been a number of benefits for the clients that have taken part in the PrEP Moving On service. These have included social reintegration, empowerment, enablement to manage their condition more effectively themselves. This has sort of decreased the dependency on statutory services and allowed clients to manage themselves back into employment, education and back into their own lives. Collaborating with Northern Ireland Chest, Heart and Stroke on the research project allowed us to build evidence that the patients taking part in the service were gaining from its delivery. This included social reintegration, evidence that patients benefited functionally from the service, and also the emotional support they gained from it. This has been a very worthwhile project and something that I know the Trust will be happy to deliver in the future.
And I found that the programme offers them education advice further down the line when perhaps they're more amenable to listen to information and to digest it. Information covered such as why a stroke happens, what is a stroke, healthy eating advice and so forth is invaluable at that particular time in their recovery, and helps them to live healthier lifestyles and help prevent further events from happening in the future.
The services certainly helped me. From that first day, I was a changed man.
My favourite thing was getting out of the house and meeting other people who had a similar experience as I had. Being part of the group has helped me in lots of ways. Confidence, communication, and the exercise programme helped me too, because I was very lazy in doing exercises.
The exercise regime is the main thing for me, and I think it should be for everybody. If there are symptoms, it allows them. I've joined the gym again since it. My ambition is to get out on the golf course again.
After I finished in the research, I missed the exercises. They helped me greatly with my balance and walking abilities and confidence and everything. I bought an exercise bike, and at the moment I'm setting it up to use it.
The whole programme of doing exercises and education and everything else had done me that much good that all the tablets and medicine in Ireland wouldn't have been as good for me. Would have been more psychological the way the stroke affected me, and I got into the way of going within myself and not coming out. And when I went along to the stroke, it finished up. It was the best thing I ever had done.
The special things for me was the information about the stroke, how it can affect you, the communication, the emotions and all those things to do with the stroke.
When I had the stroke, it was a big shock. I was in total denial, and by being informed about, you know, what happens to you, what are the normal things such as fatigue and memory loss, and you know, and speaking with other people that have had strokes, it brought me back into reality.
Well, before I started this 12-week programme, I was dependent on other people to do things for me, and now they can do them myself. The exercises have really helped me to carry cups and saucers and doing washing up and stuff like that. Try to be a lot more independent now with my kitchen skills and stuff, and you know, around the house. I live on my own, by the way, and I'd make myself a cup of coffee and a cup of tea sometimes and cook for myself.
Working with Northern Ireland Chest, Heart and Stroke has allowed the Southern Trust the opportunity to build its partnership working and its relationship with the voluntary sector. This has benefited us in terms of financial gains, in terms of the professional relationship we have with Northern Ireland Chest, Heart and Stroke, and enabled us to widen the amount of services we can provide to stroke survivors in our area.
I'm slowly edging back to what I was before, and I can't praise you highly enough, for that benefit,